Kidney transplantation, procedure, eligibility, and long-term outlook. Kidney transplantation is a surgical procedure in which a healthy kidney from a donor is implanted into a person with end-stage kidney disease or kidney failure. It is considered the most effective treatment option for individuals with irreversible kidney damage, offering improved quality of life and long-term survival compared to other treatment methods like dialysis. Here is an overview of the kidney transplantation procedure, eligibility criteria, and long-term outlook. Procedure. Evaluation. Before the transplantation, the recipient undergoes a comprehensive evaluation, including medical tests and assessments to determine their overall health and suitability for the surgery. Finding a donor. The donor can be either living or deceased. Living donors are usually family members or individuals who are emotionally or genetically related to the recipient. In some cases, paired donation or altruistic donation can also be considered. Deceased donors are individuals who have previously consented to organ donation. Surgery. The transplantation surgery is performed under general anesthesia. The donor kidney is placed in the lower abdomen of the recipient and connected to the recipient's blood vessels and bladder. The recipient's own kidneys may be left in place unless they are causing complications. Postoperative care. After the surgery, the recipient is closely monitored in the hospital for several days to ensure the transplanted kidney functions properly and there are no complications. Medications to prevent organ rejection are started immediately. Eligibility. Not everyone with kidney failure is eligible for transplantation. The eligibility criteria may vary depending on the specific transplant center and country, but generally, the following factors are considered. End-stage kidney disease. The individual should have irreversible kidney damage that severely affects their quality of life and requires dialysis or other kidney replacement therapy. Good overall health. The recipient should be in reasonably good health, apart from their kidney condition, to withstand the surgery and post-transplant medications. Absence of contraindications. Certain medical conditions, such as active infections, active cancers, or severe heart disease, may prevent a person from being eligible for transplantation. Long-term outlook. Kidney transplantation offers several advantages over long-term dialysis. It improves quality of life by restoring kidney function, allowing individuals to resume a more normal lifestyle. Transplant recipients typically experience increased energy levels, improved appetite, and better overall health. However, long-term success depends on several factors, including the recipient's overall health, adherence to medications, and post-transplant care. Immunosuppressive medications are prescribed to prevent organ rejection but may have side effects and require lifelong usage. Regular follow-up visits with healthcare professionals are essential to monitor kidney function, manage medications, and address any complications. With proper care, a successful kidney transplant can provide a better long-term outlook compared to other treatment options, potentially lasting for many years or even decades. However, each case is unique, and individual outcomes may vary. It's important to consult with healthcare professionals, including transplant nephrologists and surgeons, to discuss specific eligibility, risks, benefits, and long-term expectations related to kidney transplantation. Types of kidney transplantation. Living donor transplant. In this type, a kidney is donated by a living person, usually a family member or a close friend. Living donor transplants tend to have better outcomes compared to deceased donor transplants. Deceased donor transplant. In this type, the kidney is obtained from a deceased person who has previously consented to organ donation. Deceased donor transplants are more common due to the limited availability of living donors. Organ matching. To increase the chances of a successful transplant, compatibility between the donor and recipient is crucial. Human leukocyte antigen HLA typing is performed to assess the degree of compatibility between the donor and recipient. A closer match reduces the risk of rejection. The cross-match test is conducted before transplantation to check for any antibodies in the recipient's blood that may react against the donor's kidney. A positive cross-match may indicate a higher risk of rejection. Waiting list and organ allocation. In many countries, there is a waiting list for deceased donor kidney transplantation. The allocation of organs is typically based on factors such as blood type, tissue match, and waiting time. The waiting time for a deceased donor kidney transplant can vary significantly depending on the availability of organs and the demand for transplantation. Immunosuppressive medications. After transplantation, recipients are prescribed immunosuppressive medications to prevent the immune system from rejecting the transplanted kidney. These medications suppress the immune response, but they also increase the risk of infections and other side effects. Commonly used immunosuppressive drugs include calcineurin inhibitors, such as tacrolimus or cyclosporin. Antimetabolites, such as mycophenolate mofetil or azathioprine, and corticosteroids. Potential complications. Despite advances in transplantation techniques and immunosuppressive medications, complications can occur. Some potential complications include rejection of the transplanted kidney, infections, side effects of immunosuppressive drugs, surgical complications, and recurrence of the underlying kidney disease. Lifestyle changes and monitoring. Following transplantation, recipients need to make certain lifestyle changes, such as maintaining a healthy diet, exercising regularly, avoiding smoking, and managing stress. Regular follow-up visits with healthcare professionals are essential to monitor kidney function, adjust medication dosages, and address any issues or complications.